Now, once you have diagnosed stroke, you need to treat it. So for that, the treatment is divided into two groups, that is general treatment and specific treatment. Now, general treatment is very important in a way that it is uh, it is basically done to prevent the further complication of hospital stay and to stabilize the patient in the first place. So, number first is maintain airway. Secondly, we have to treat hypoglycemia with 50% dextrose, or if the patient is hyperglycemic, we have to treat him with insulin. Also, the patient should be given a water bed, or the patient should be advised or rather helped with the change in position every 2 hours, because this helps in preventing bed sores. Pneumatic compression stockings should be given so that it can prevent DVT, that is deep vein thrombosis. And also, physiotherapy should be performed to prevent contractures or any edema. Now, let's move on to the specific treatment part, and we'll deal with the infarct first. So for an infarct, the first thing that we have to do is control of BP, that is blood pressure, and it should be done with IV levetolol, that intravenous levetolol, or enalapril, or sodium nitroprusside only. And it is to be done only if the following conditions are fulfilled, that is, number 1, if the BP is greater than 220 systolic by 120 diastolic millimeter of mercury, or if the mean BP is greater than 130 millimeter of mercury. Or it can be done in case of pulmonary edema, in a case of renal failure, or in a case of acute myocardial infarction. And if thrombolytic therapy is planned, the BP should be reduced only if the BP is greater than 185 systolic by 110 diastolic millimeter of mercury. Now we have to control cerebral edema, which is done to prevent brain herniation by decreasing the intracranial pressure, and it also helps in preventing the worsening of symptoms, and it is done by using 20% mannitol, that is given by IV infusion, or glycerol, or furosemide. Number 3, anticoagulants. The role of anticoagulants is still controversial, so these are to be better avoided during the first 48 hours after the stroke. And the various anticoagulants that can be used include heparin and warfarin. Now moving on, we come to the thrombolytic therapy for stroke, which is the basic essence of treating the stroke due to any infarction or a thrombosis. So thrombolysis can either be done by reticulase or tenecteplase. These both are tissue plasminogen activators. And thrombolytic therapy should be started within 4.5 hours of the onset of stroke, and that is why this 4.5 hours, it's called the golden period for management of an ischemic stroke. However, this therapy cannot be used for the following individuals because it might worsen the condition even more. So the various contraindications for the use of thrombolytic therapy is: number 1, blood on the CT scan; number 2, large hypodense lesion on CT scan; number 3, an active internal bleed; number 4, bleeding diathesis; number 5, if the blood pressure is greater than 185 systolic by 110 diastolic millimeter of mercury; number 6, if the patient has undergone any neurosurgery within the past 3 months of stroke; and number 7, if there is any history of intracranial hemorrhage any time in the patient's life, then we do not do thrombolytic therapy. This sums up the specific treatment for a ischemic stroke or an infarction. Now coming to hemorrhagic stroke. Well, the specific treatment for a hemorrhagic stroke includes: number 1, we have to control the BP, and it is divided into two parts. Like in a case where the patient is already hypertensive, if his blood pressure reading comes to greater than 180 systolic by 105 diastolic, we have to reduce it to 160 systolic by 100 millimeter of mercury diastolic. However, in a case of previously normotensive patient, if the BP is greater than 160 systolic by 95 diastolic, it should be reduced to 150 systolic by 90 diastolic millimeter of mercury. Second is decrease the intracranial tension by giving mannitol or glycerol. Now this decrease in intracranial tension is the essence of the treatment of hemorrhagic stroke, because since the hematoma is already formed inside the brain, so it takes up a part of the brain intracranial cavity, and we allow the edema to occur. It will lead to further compression of brain and lead to worsening of the symptoms. So this helps in early resolution of symptoms. Number 3 is the surgical approach, which is done for evacuation of hematoma, and it is done for deteriorating patients, or in a case of brainstem lesion, or in a case of hydrocephalus. Now after treatment of stroke, we have to give advice to the patient to prevent the recurrence of stroke, and these all points include: number 1, cessation of smoking. We have to ask the patient to stop smoking completely. Number 2, control of diabetes. Number 3, control of blood pressure. Number 4, antiplatelet drugs like aspirin. And anticoagulants like warfarin should be started in a case of atrial fibrillation. We have to reduce the blood cholesterol by use of statins, that is atorvastatin, simvastatin, and also we have to ask the patient to come for regular follow-ups. And this is very important because cardiovascular accident is not an accident but an accident waiting to happen.